Hi, I'm Dr. Celina Nadelman, and I'm a board-certified cytopathologist and fine needle aspiration specialist based right here in Los Angeles. Let's talk about the steps of your fine needle aspiration, also known as an FNA, and what to expect from your first visit all the way to your results. Step 1 starts with a consultation and evaluation. When you walk into my office, you're not stepping into a cold or impersonal clinic. You're entering into a comfortable space designed for thoughtful, personalized care. Finding a lump can be stressful, and our goal here is to give you fast and accurate answers where it matters most. During your consultation, I'll review your medical history, discuss your concerns, and perform a physical exam. I'll use high-resolution ultrasound to look closely at the lump or nodule of concern. This help determines whether an FNA biopsy is the next step. And if it is, and you are comfortable doing so, we can move right into the procedure during the same visit so that there's no waiting and no need to schedule a second appointment. Step 2 is the ultrasound-guided biopsy. An FNA biopsy is a quick, minimally invasive procedure that uses a very thin needle to collect cells from the lump that we identify. I use ultrasound guidance to precisely target the area, which helps improve accuracy and minimizes discomfort. You'll receive local anesthesia with no sedation required. Most patients describe it as a quick sting, and then the area will be numb quickly after. A thin needle is inserted into the lesion and moved in and out, much like sticking a straw into sand. Imagine that the cells are particles of sand, and as I push the needle in and out, the cells, much like sand, go up the needle. I go into all parts of the lesion like spokes of a wheel to ensure that I'm sampling it well. And once the cells are collected, they are immediately ejected onto the slides. Some slides are immediately fixed in alcohol, while others are air dried so that I can stain them immediately and check them at the bedside. In addition, if I think I need material to send for other studies, I can collect more from the site. This ensures that I have enough material for a proper diagnosis and helps prevent the need for a repeat biopsy. After the procedure, I place a small bandage and apply an ice pack to reduce swelling or bruising. You can eat, drink, and return to normal activities, but I do recommend avoiding strenuous exercise for a few days, which will help prevent further bruising. Step 3 begins with the lab, interpretation, and results. What makes my practice unique is that I perform and interpret every biopsy myself. As a board-certified anatomic pathologist and fellowship-trained cytopathologist, I'm the one to examine the cells under the microscope and make the diagnosis right here in my lab. This means no long waits for results. Most patients receive preliminary findings within 24 hours from the referring doctor. And if additional testing is needed, I'll explain those steps personally so that you can always understand what's happening. From consultation to diagnosis, everything happens under one roof, with me guiding you every step of the way. For more information or to schedule your appointment, visit our website, drnadelman.com, or call our office today.